you.
Oh, wow. I love that we are all in pink. Different shades of pink. Welcome. Dr. Anita, this is your first time?
Yes, please.
Yes. So how are you doing?
I'm fine, thank you.
Great, and thank you so much for being here.
Thank you for having me.
And Fafa, you are not new to the set at all. This is home.
Yeah.
For those of you who have never heard of Fafa's story, Fafa was diagnosed with stage 4 breast cancer, and she survived it. And she's looking so beautiful today. Oh, God have mercy. How many people tell you that you look beautiful? Let me say the word well. Beautiful. You hear that a lot, don't you?
A lot.
Wow.
But we give God all the glory.
God is good.
Yeah,
God is good.
God is good.
All the time. So today we want to talk about the relationship between a doctor and a patient in times of difficulty, because that time is very difficult.
Yeah.
How your doctor tells you is even a way of whether you survive it or you die.
Exactly.
So I'll ask you, Fafa, how did your doctor give you that diagnosis?
Okay, thank you for the question, and it's nice to be back here.
Yeah.
After the labs, the final labs and everything, I went into the doctor's office with my sister. He opened the results. He looked at me and he said, "It is well." He said, "It is well." Then he said, "Look, we have to start treatment ASAP." Then, if you really ask me what he said, apart from me hearing him saying it is well, I don't think I remember any of the other things he said, because I burst down in tears. It was all tears. But my sister listened to everything he said, and then when we got home, she was like, "Okay, this is what the doctor said. We have to start treatment ASAP." So I was referred to another facility. I don't want to mention it.
Right.
But my experience there was really bad. I won't lie to you. Because anytime I go to that facility, I enter the doctor's room and they tell me, "Okay, just wait a minute, we'll be back with my labs." And then the doctor takes it somewhere, I don't know where. But then he or she comes back and it's like, "Okay, the doctor says this and this." So I asked, "Can't I see the consultant myself?" He said no. And it happened about 3 or 4 times. And I just said, "Okay, I'm not coming back here." So I got home, I went online, I started looking for other facilities, and I got one. And truth be told, Rosalie, the very day I entered that facility, I told myself, healing is here.
Amen.
The very day I entered, as soon as I walked in, wow, healing is here. The environment was so welcoming, everything was in place. So I entered the doctor's office, the environment was so welcoming. The doctor spoke to me with a lot of empathy. It was like, this is, I don't know how to explain it, but you can just feel healing is here.
That gave you a source of encouragement.
A lot. Because before I left home that day, actually, I was broken. I was filled with anxiety, fear, doubts. I had lost it in a way. So only for me to get there, and this is the facility, this is the doctor, so nice, speaking with a lot of empathy, compassion. Like, this is all I needed. And someone to just tell you it is well. Yeah,
this is what a lot of patients need, but some doctors lack it. So, Dr. Anita, for you as a doctor, when you're given the diagnosis to the patient, how important is it for you to give the message well? Let me put it like that.
Okay, so it's extremely important, because how the patient receives the information is key to what happens thereafter. So for Fafa's case, for example, she mentioned that she was there with her sister. So usually before you give any form of bad news, and in fact, when you say bad news, it can be different things to different people. So there are certain women, if you should tell them today that you are pregnant, it will be bad news. And there are some, if you tell them you are pregnant, it will be good news. Yes, so as the doctor, you should be able to, you should have that relationship with your patients. So when you see the patients, the history you take, the perceptions that you get from the patient should inform you. You see, and then before you even give the bad news, ideally, you should find out from the patients, what do they want to know? Do they have somebody that they want to be in the same room with them? And you need to ask who that person is. A lot of times in certain people call people my sister, my brother, and somebody will ask, is it same father, same mother? Because ideally that is the explanation.
Okay.
The same father, same mother. But there are people who do not want their
Those people
sister
there.
Yes. And so you should ask. We don't just give information out. So you get all those things out of the way, make sure the support person is there. And then you tell the person that unfortunately, this is what we have found. Yes. And like she said she didn't hear anything. It was her sister who heard
everything.
And then when they went home, the sister told her. So that is also another thing. At that first visit, it is very likely that the patient will not hear what you said. So it is important that there are follow-ups. So the patient has to come back. At that meeting, you can actually ask the patient, so what did I say? What did you hear? And the patient will tell you back whatever they heard. Then you give them time.
So you have to ask the patients that?
Yes.
Papa, were you asked?
I don't remember.
You don't remember.
I don't
That's
remember.
the thing.
Yeah, I don't remember.
So I am a family physician. So family physicians, we have training in these things, communication, breaking bad news, how to deal with family support. We have training in that. And so normally as a medic, you should get all that training. But of course, you practice, and you fall into a certain routine, and the finer details sort of escape you.
So that becomes a norm for some doctors.
Exactly.
You know, they've seen it all. Maybe the facility that Fafa you visited, the second facility you visited, maybe the doctor saw stage 4 and said, I've seen it all. I mean, why do I have to see? Is that how you felt though?
Yeah, that's exactly how I felt. Because I don't know why I should walk into a facility, I am paying for the service, and I don't get to see the doctor or the consultant. Why? What's the excuse?
Felt that you won't survive it.
I don't know, I felt, even before I got there, I had already lost hope.
Wow.
Yeah, because the diagnosis, stage 4, I was like, stage 4, what's left?
And the doctor also made you feel like that?
And yeah, and I'm sorry to say this, but my sister is my witness. When we went to the first facility, when I'm even talking to the doctor or he's asking questions, he's on his phone.
Huh?
Yeah, there was never any eyeball-to-eyeball contact. He was always on his phone typing something or researching something. Yeah.
Wow.
So it means from the beginning he's already given up on you or given up on your case.
I can only imagine the emotional struggle you went through because of that.
Yeah.
When you left, was it still haunting you, that action from the doctor?
Oh, yes, it did. It did. There were nights I never closed my eyes till the next morning. Because all I keep thinking about is, you won't survive this. This is stage 4 they are talking about. And I started reading a lot. So I think because I was reading too a lot, I was feeding myself with a lot of negative information. Because you read stage 1, oh, this is your chance of survival. Stage 2, so I'm like, stage 4,
Gone.
they're gone. It was very traumatic, yeah.
Dr. Anita, you know, do you actually, as a medical doctor, look out for the subtle emotional signs in the patient when you are delivering these messages?
It's all part of the communication skills that a doctor should have. So when you are communicating with the patients, there's the verbal and then there's the non-verbal. So the non-verbal, the patient's demeanor, the things that they do, whether they are making gestures, all those things are part of what we are supposed to be looking out for. And even we as medics, like she said, the doctor was on his phone. Yes, it's also something that we are supposed to be careful about. So you are supposed to have a demeanor that is open. So something like typing on your phone, whatever. Yes, sometimes you may want to do some research. sometimes you may want to have a consult with another doctor.
More classroom.
But
now the doctors are always like, checking chat GPT and all of that.
Not necessarily, not necessarily. So now there's a lot of information. There are sites like UpToDate, Medscape that can actually update you with information. And now patients are extremely enlightened. So she would have come with questions. She has read so much and she would have come and you would have to confirm. So the thing to do is you need to communicate with your patients. Tell the patient, oh, I have not heard this, or I have not seen this, so let me check.
If you say that.
No, it depends on the relationship you have.
Okay.
So if you come, I introduce myself, we have a chat before I start taking the history. When that trust is built,
right.
When I tell you I have to check something, you have that trust with me. So you know that I am looking out for your best interests. And so you will not think I am doing something other than what I told you I am doing.
What are the emotional signs that you look out for? What are some of the things that they do that you realize that, no, this person is traumatized, and so I need to find a way to give the diagnosis without affecting the person?
So eye contact. Eye contact is key. If the patient is not looking at you, they are looking elsewhere. We have something we call affect. So you are talking to the person and the person is just flat. Yeah. Like they are not reacting. So most likely, whatever you are saying is not going. They are not hearing you, they are not understanding you. So we look at all those things. And the gestures that the person may make, how open the person is. If the person has folded their arms and is all closed up, you can actually tell that this person is not hearing me. Yeah, so all those things will tell you whether or not your patient is actually receptive to what you are telling them.
Wow. And then after you are diagnosed, Fafa, I mean, the doctor that you went to, that you felt everything was going to be okay, how was he treating you? What were some of the things he was saying that encouraged you?
So that was actually where I ended up having my treatment.
Okay.
That was the third facility. The first was where the diagnosis was confirmed. Then I was referred to the other facility, which was like a 0/100.
Yeah.
And then the third, which is like
100/100.
So walking in, talking to him, he said, before we even do anything, I have to see a psychologist and go through counseling. And I asked, do I really need that? He said, yes, he needed it. So that was the first step. I went to see the psychologist. We went through a series of counseling. It showed me pictures, diagrams, took me through. She did a lot, and she did very well. The psychologist did very well. So before I even started treatment, though I was still scared because I was like, chemo, the side effects and all of that, I was 60% ready for the treatment. I was 60% ready for the treatment. Look, there were days after chemo, 3, 4, 5 days after chemo, I could go out just to sit somewhere, maxed up, listening to music for 2, 3 hours, and I'm going back home.
That's nice.
Yeah, because at a point I realized, no, whatever it is, you survive this. Because anytime I go to see the doctor, he's like, wow, you're looking so nice today.
Yeah.
How have you been? Like, he jokes.
Yeah.
Look, he is so good. He is so good. And there are days I can just call him even till date. Before I even go for my appointment, I'm like, oh, blah, 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 blah. When is my appointment? He's like, have you forgotten? I'm like, okay, let me go through. We go through and he's like, okay, maybe you have to come in next week. Before you come, do this, this, that. Like, we laugh. He can even call me over other issues which are not even about my treatment. So anytime I walk into that facility, I'm like, there's no problem. Even if there's no problem.
Yeah.
You understand? And I think, I know it's difficult because some facilities are overcrowded, let me put it that way.
Yeah.
So at times you can't blame them. But this is the first time I'm coming into your facility. And this is not malaria or typhoid I'm coming in with. This is a terminal disease. So at least let me feel loved. Let me feel heard. Like, just let me feel you are listening to whatever I'm saying.
Right.
Yeah, we need it a lot.
And for you, the love that you receive from this third facility's doctor maybe could be the reason why you survived, right?
Yeah, most likely. Most likely. Because he never made me feel like, oh, this is a bad case. No, no.
Oh, really?
He never for once made me feel this is a bad case. He said, okay, we start with this, we go on a break, we see how it works. we continue with this. If it doesn't work well, we change the medication. We do this. So there was always a backup plan. And there were days when I go to the hospital for chemo, and let's say my blood level was low, there's something that I don't really have the medical terms, but he tells me, okay, we have to take a Neupogen injection, and then you come back in a day or two. By then, the level would have gone up, and then we could do the chemo, because he didn't want us to even break the treatment plan. Yeah.
I mean, you won't even think that these things mean a lot, you know. You won't think so. You think that it's just a laugh from the family that means a lot. You won't think that the doctor relationship matters so much.
It does matter.
But then when do you draw the line? When do you say that empathy is coming in, but I still have to be professional, doc?
Well, empathy, professionalism, your main issue is not to do harm to your patient. You see, so when it comes to professionalism, we have the ethics of our profession. And so you should not do harm. That is the main thing. So we have training. We have training. So as you interact with your patients, you should be able to tell when certain lines are being crossed. So empathy is key. Definitely, empathy is key. The confidentiality is also key. So you have a relationship with your patients. You know the things you are telling your patients. What the patient has allowed you to tell their family members or their friends, whoever is accompanying them to appointments. All those things, you should have a line that you draw. So we know what we are supposed to do, and we know what we are not supposed to do.
Right.
And so the ethics of our profession is supposed to guide us. Okay, but the thing is, the routine, the mundane, is what gets to a lot of doctors, and they seem to forget. That is not an excuse, because every single patient sitting before you is different. Every single patient sitting before you is an individual, and they have a family. And all those things affect the interactions that you have with your patients. Okay, so if, for example, a patient has a sister who is a doctor, and they come before you and they see you like their sister, if you relate with them on that level, they are more likely to actually listen
to you more.
Yes, they are more likely to listen to you.
But do you, or no, maybe you know, do doctors know that how you treat a patient will let the patient survive?
Oh, yes.
Because some doctors are rude, though.
Oh, yes. So, you see, that is why I always say that education is not just going to school. Education is not just going to school. I have a personal experience of going to the clinic with my mom. And there's this young lady doctor who sees us. I don't know, probably because of the way my mom was stressed. I don't know what. My goodness. Like that day, only God help me. You know, she doesn't want to talk to us, and she's like, go do lab. And we are like, what lab? She said, the lab technician has it. We don't have a right to know the lab she's going to do. You do.
And then she tells us that, well, I've sent it to the lab technician. My sister's like, she's like, well, she's not feeling well. She the doctor, I'm not feeling well. I don't feel like talking. I said, huh? So yes, I can imagine. And you know, we have this habit of, if you argue the doctor can give you a wrong medication and it will kill you. So you have to keep quiet. Is that true, though? Does it happen?
That's not true. That is not true. That is absolutely not true. If you have that experience, you need to report it. That's also something that happens a lot in our parts of the world. People do not report incidents that happen.
Who are you reporting it to?
There are laid down procedures in the hospitals. So you are supposed to find the administrator and make a report. Unfortunately, you see, systems don't work in our country. But whatever you can do, your responsibility is to do what you can do. And then after that, you leave it for the systems to work. So if you need to make a report, you make the report. That is very important, because a lot of times there have been instances where we know there's an issue with somebody, but where is the evidence? where is the evidence? Nobody has come to say it. So if you go and say it, it's like, where is your evidence? Exactly. So the more, as people become more enlightened and are able to make those reports, then yes, the evidence is there, and then action can be taken. But unfortunately, in fact, it is something that is everywhere. We don't have research, we don't have data.
And that's a problem.
We just say things and there's no evidence behind it.
That's sad. But Fafa, were there times that you, although the doctor was nice to you, you struggled to pour out your emotions to him?
No, never. I could always talk to him about how I was feeling. There was never a time I got into that office and said, maybe today, even if I had to cry.
He was there?
Yes. There was never a time I walked into that office and felt, oh, today I have to know.
Wow.
Yeah.
That's God sent then. Yeah, he's truly God sent. Because there are few. I don't know why it's a few.
Yeah.
Doc, can you tell me why there are few like that? Is it the stress in the system? Is it that some doctors are not being paid well? What is it?
Oh, definitely. Definitely.
I like doctors.
Definitely. But it's what we are called to do. Yes, it's what we are called to do. So you need to put your best in it. Yes. There are challenges, and sometimes it's difficult to deal with the challenges. But the patient sitting in front of you also has their challenges, and they've come to you for help. They've come to you because you are the doctor. And so it's important that we put that at the forefront, yes, and attend to our patients and make sure that we have the relationship with our patients such as the patients will trust us and adhere to whatever management, because she trusted that doctor. Yes, she trusted him.
As a doctor, apart from the patients coming into the hospital to see you, must you also check up on, the patient at home? Must it be routine, even not during working hours?
It's not something you are advised to do.
But does it help?
So it helps. It helps. So for me as a family physician, we do have the aspect that deals with home visits.
Okay.
So as family physicians, we are trained in providing that service. So yes, but it is at your discretion because there are medico-legal things that come with it. Because calling your patient outside of working hours, any advice you give to that patient will be constituted as medical advice. And if there's any trouble that comes out of that, you can actually be held liable. So from the very beginning, that's why communication is important. When you have that communication with your patient and you make it clear that that advice outside of working hours is also constituted as medical advice, then you are liable for whatever happens outside of it. But if you also make it clear to the patient that when I call you outside of this time, it is not working hours, and so you need to go to the hospital. If something is happening to you, you can call me, but you need to go to the hospital for a doctor to see you and actually manage you. Then you are covered. But ideally, that sort of relationship, it can land you in trouble. Yes, it can.
Yes.
Can I just add to this? In that facility, what they usually do is because of the chemotherapy and the effects the chemo has on your body, you have access to 24-hour telephone calls to the doctor and the team. So whatever happens, whatever time, even if you call the doctor and you don't get hold of him, you can call one of the nurses. So they tell you, okay, walk into the nearest hospital or something, and then call the doctor and let me talk to him. So because she is your doctor or your nurse, your oncology nurse, so she can now explain to the doctor, okay, this is her situation, this is the treatment we gave her last week, and maybe due to this and this is the effects. So please give her this or that. So I had 24-hour access to the medical team. Yeah. Yes. SGMC.
So that's a system they have. Yes. So those things have to be clearly stated out.
Yeah.
Yes, they have to be clearly stated so that you have that sort of relationship.
Right. Anyway, so we have some messages coming in. Maybe you're just watching in or you're just tuning in and you're watching us. You can send your messages to us on 055-157-5757, 055-157-5757. Now, Fafa has a beautiful foundation. She'll tell us about it. Isayen also has the Awareness Month. They have so many activities that they have lined up for you to benefit from. So they'll tell us. But Shola, what messages do we have?
A number of messages, because once again, I think that October is one of the most important months in the year. Although I still stand on the fact that if you're a woman, don't only wait till October to go and check your, you have to check it as regularly as you can. But we all know that October, we leave it for that. But Rosalind,
yes.
The first one is asking a question. It says that, Rosalind, I menstruate every month, but before my menstruation, there is liquid that comes out from my breast. I am not a nursing mother, and I've never given birth before. Is it very regular?
Doc. So the breast tissue is responsive to sex hormones. Yeah, so for women, the sex hormones are estrogen and progesterone, and that's what drives your cycle. That and some other hormones. So that's what drives your menstrual cycle. And so it can have an effect on the breast, and that's actually one of the things that can lead to breast cancer, the effect of the sex hormones on the breast. Yes, so it can be normal. Once it is every month and you know it is with your cycle, it can be normal. Okay. So you should know what is normal for you. Okay. So for example, you've seen that this discharge comes every time I'm about to have my menses, and it is clear or it looks like milk. So the moment you see that this discharge is bloody or is greenish, then that should tell you that no, this is not what usually comes out, and you should have it checked. So it's important that while we know our bodies, we should know what is normal for our bodies. And then when the abnormal happens, we can easily detect it and then get it checked.
Okay, great.
Yeah. All right. Now, Rosalind, this one also says that when it's cold, my nipples get extremely hard. I'm afraid. Is it normal?
That is also normal. So the nipples react to the vessels in the breast around the skin. Yes, they get, they react to cold. Yes, and then they get tender. They also react to sexual arousal and also, yes, become hard. So that is also normal.
But how many minutes is regular? Because, for instance, someone's nipple is hard for about like 5 to 10 minutes. Is it normal?
It depends on the person. Yes, It depends on the person. It can be, so for cold weather, sometimes for as long as it's cold, the nipples will be hard. Yes, it depends on the person.
Right. You see, sometimes it can be very hard and then it gets painful. Is that also normal?
So that can also be normal. So you see, once you know the response of your body, yes, that can be normal. So to cold, to sexual arousal, to sometimes even fear, yes, you can have those responses.
Right.
Yes.
Okay. Rosalind, there's more. This one says, good day. This case is a malformation from the uterus, not the delivery process. This could have been identified with an anomaly scan when the mom was pregnant and the family decided to continue the pregnancy or do a medical abortion. So this is from our formal conversation. This one also says, hello, good afternoon. Please tell her I thank God for her life. This one also says, Rosalind, your bow tie, someone is calling you Barbie. It says, okay, your bow tie has occupied half of the studio.
I tell you.
Why did you? Right. This one also says that my mom has been complaining about pain in one of her breasts. She's taking it to several hospitals, even Kolibu, but they say that there's nothing bad about it, but it really pains her. Is it normal?
Oh.
So we'll need to have an assessment done. So her age, certain risk factors, all those things need to be done. But there are also certain conditions that affect the breast that could cause pain. And again, the hormonal cycle. So for some, before their menses, the breasts get very heavy and very tender. And so that can also be part of the cycle. So all those things. So ideally, when we see you and we do all these assessments, we should be able to tell you that this is what it could be, so that you are not worried. Because it sounds like she wasn't really told, she was just told there's nothing bad found. But most people ask, if there's nothing bad, then what is it? Yes, so
but some of the doctors are also rude. And so if you ask what is it, that there's nothing wrong. I just told you there's nothing wrong.
It's unfortunate.
It's unfortunate.
Right.
Anyway, so I hear my studio audience, some of you want to ask questions. Yes. Oh, yes, darling.
Please, when you got diagnosed of breast cancer, how did the society, family, and friends treated you?
Okay, when I got diagnosed, I didn't tell a lot of people actually. It was just family first. So it was when I had finished majority of the treatments that I could tell a few friends, like that's those I was very close to, because I was scared of stigmatization. Yeah, but after some time, I just said, look, I know my status, and I think hey, that's a good one. Yeah, because you trying to talk about me or you trying to stigmatize me, you don't know your status. You don't know what you're carrying. So I am so better off. I just said, excuse me to say, to hell with everyone.
Yeah.
This is me.
Yes.
Okay, so I wanted to know, can a man be diagnosed of breast cancer?
Oh, yeah.
So anybody who has breasts can get breast cancer. Anybody who
Even
has
children?
breasts. Yes, so it depends on, like again, the hormonal, yes, but normally the biggest risk factors. So a risk factor is something that would increase your likelihood of getting breast cancers. The main breast cancer risk factors are being a woman and age over 40. But that doesn't mean that if you are not a woman, you cannot get breast cancer. And it also doesn't mean that if you are less than 40, you cannot get breast cancer. In fact, in our part of the world, we're actually getting more younger women getting breast cancer. And we do have men getting breast cancer. However, if you look at all the cancers in men, it's less than 0.1% that are breast cancer. Okay, so it's not one of the top 5 cancers in men. Okay. But men can get breast cancer.
Men can get it. What about the children? It's the ones that menstruate early, right?
Exactly. So remember I talked about sex hormones.
Yes.
So estrogen and progesterone drive the menstrual cycle. And so estrogen in particular, your prolonged exposure to estrogen is a risk factor for developing breast cancer. And so women or girls who get to menstruation early, we call that menarche. Yes, it's one of the risk factors because estrogen is activated early. And so that is why they start getting their menses. And if they stop menopause after 55 years, so say you start your menses at, let's say 10 years, and you have menopause at 55 years, that's like 45 years of exposure to estrogen. Yes, so that exposure can actually drive breast cancer.
So early menopause actually helps, right?
Yes, it reduces your exposure to estrogen. Having children, also getting pregnant also helps because pregnancy breaks that exposure. When you are pregnant, you don't have your menses for about 9 months. So it breaks, or it can go all the way to 18 months for some people. So you can have those breakages in your cycle. Yes, so it reduces your
Wait, Fafa, you were diagnosed when you were breastfeeding, right?
Yes. With my 4th child.
With her 4th child.
Yeah,
so with Fafa, she had babies back to back, and her 4th child, during breastfeeding, she discovered a lump in her breast.
Remember, I've seen patients who were pregnant, and that is when it was discovered. Yeah. So risk factors are not causation. Risk factors does not mean that is the cause. So that's why I said for women and then more than 40. But those two do not mean that if you don't have them, you will not get. Okay. There are different other risk factors. Apart from the sex hormones, we have family history. And family history is not just breast cancer. There are certain cancers that run in the family. So prostate cancer, ovarian cancer, colorectal cancer. Some of those cancers actually have genetic mutations behind it. So there's something in your DNA that is driving the expression of the cancer genes. And so if it is within the family, you may have everything negative. You can be a woman who is 20, maybe you had your menarche at 15 years, so you don't have a lot of other risk factors, but because of that genetic expression, you will get it. So the risk factors are not causation. Okay. Yes, they are not causation. They increase your likelihood. But not having a risk factor does not mean you will not get breast cancer.
All right.
Yes, Roslyn, we have a few comments. This one says, I really love this program. It's very educative. Please ask the doctor for me. My prolactin levels is very high to the extent that it's around 98. I'm not breastfeeding, neither am I a mother, but the breast milk keeps coming. I've started Kebagolin, recommended by the doctor, but I'm not seeing any changes. Please, any advice?
So she will have to continue treatments. There are certain conditions that can cause hyperprolactinemia. So it is a possibility that she has one of those conditions. As I said here, I cannot make that diagnosis, yes. So she will have to continue treatment and then they'll monitor and see.
Okay. This one says, please, my friend gets this fluid being discharged from her breast. It's been coming for over a month. Is it normal? And if not, what should she do? She says it looks like a milky substance and she's scared too. So
she needs to have it assessed. So some of the clinical features that come with breast cancer, you can have a lump, you can have breast pain, you can have a rash, you can also have nipple discharge. And there are even some cancers that appear like a sore on the breast. So it is a cancer of the skin of the breast. So you can have like a sore of the breast. And sometimes it can even spread into your armpits before you notice there's something on your breast. So anything that is abnormal, since she is saying it's been for just a month, I would advise that she goes to the hospital for it to be assessed as soon as possible. For it to be assessed.
All right.
Now, Roslyn, I personally want to ask you a question because I've heard about 2 or 3 young girls say that they do not have any sensation from their breast. They are saying that because when they have intercourse with their partners, you know how it goes. If anything goes there, they don't feel it. Is it normal because they are quite scared about it?
So when it comes to sexual arousal, everybody and what they find arousing.
Right.
Yeah, so ideally, we have the erogenous zones. Yeah, so for most women, it is thought that the breasts are erogenous zones. So erogenous zones are some of the zones that stimulate sexual arousal in men and women. Yeah, so the breasts are considered erogenous zones in women, but it is not for every woman. Just the same way some people like to have their ears touched or whatever. Yes. Therefore, maybe for her, it is her ears, it's not her breast.
Right.
So it could be
find other parts of her body.
The man has to do more work.
He has to do more work.
More work. All right, maybe studio audience, just 1 or 2 other questions and then we can go. Yes? Okay, she's asking for the microphone. Please pass the microphone to her.
Yeah. Please, this one is my own issue. So I menstruated for 3 weeks, and then when I went to the hospital, the doctor told me that there was a pimples in my breast that has busted, that making me menstruating continuously like that. Is it true that something can happen like pimples can happen
Pimple
like
burst in your breast.
Yes.
That made you menstruate
For 3 weeks. Yes.
Shock.
Rosalie,
I am not aware of any such condition. I don't know if maybe...
Or was it breast discharge you're talking about? Was
pimples.
Yes, please.
Wow.
I'm not aware. So the hormones, the sex hormones have effects on your menses and they also have effects on your breasts. So there can be a correlation, but pimples in your breast bursting and causing prolonged menses.
Was it on it or inside the pimple?
I don't know. They said inside.
Wow.
But did you feel anything in your breast around
I
that
didn't
time?
feel anything. I didn't feel anything.
I think maybe the explanation they gave was
A different one, right?
a different one, or you misunderstood something.
No. They said that. They told me that that's the reason why.
Did they mention the name of the actual
No, please, they
condition?
didn't mention. They said that's the reason why.
I can't figure out what that could be.
I've never even heard it before. Pimples in the breast.
In the breast. But can there be pimple in the breast?
So you can have boils. So
In the breast?
mastitis, yes, you can have an abscess. So in fact, when she mentioned the nipple discharge, something also came to mind. When during sexual intercourse, those who have their breast sucked, that can actually stimulate nipple discharge. So the person who complained of it for 1 month, yes. If it is something that has been happening, it can actually stimulate a nipple discharge.
Okay.
Yes. So sometimes, if you have a wound on your nipple, so maybe you cut yourself or something was happening, someone sucked too hard and there was a sore, you can actually get an infection. Yes, you can actually get an infection and that can give you an abscess or a boil, something like that. Yes.
But a boil is always outside,
but it will
not
be outside, it won't be inside. Yes.
All right, okay. We are learning a lot this afternoon, aren't we? Anyway. So
yes, I have some more. This one says, "Hi, please. I have been experiencing pain in one of my breasts for a while now. Can it be a sign of breast cancer?" Rosalind. This one also says that, "Hey, I'm loving the show. Please, having stretch marks on or around your breasts, what does it mean?"
Hey.
So,
I like that one.
what's the name?
Also, I can say.
Is it not because Rosalind on a regular they don't we have lines on our
Having breast stretch marks on your breast, it's just your breast becoming big. It's your skin is stretching.
Yes.
Yeah, your skin is stretching.
So it can be normal. So it can be normal. So most people, as you even pregnant women, as the abdomen gets big, they get stretch marks. Some people, as you are getting bigger, as you grow fat, you get stretch marks. Yeah. So as your breast also gets big, sometimes you can get stretch marks.
All right.
When it comes to breast pain, usually breast cancer is not painful at the early stages. Usually the lump that appears, usually it's not painful. But there are people who can have painful lesions that lead to our breast cancer.
Okay.
So she should have it checked. She should have it checked.
All right. Okay, so you know the beautiful thing is that Fafa was here a year ago, and I'm so proud of Fafa because she has a foundation. So Fafa, tell us about your foundation.
Okay, so the name of my foundation is the Jidula Pink Foundation.
Okay.
And Jidula means a warrior.
Oh, you're a warrior.
Yeah, Jidula means a warrior. Yeah. And then...
When is the launch? I can't miss it though.
On the 5th December.
Okay, because I'm not missing. I told you,
no,
right?
you can't.
Yes,
on the 5th December.
Yeah.
So the reason why I decided to put this together is after treatment, I realized a lot of people hide their stories for fear of stigmatization.
Yeah.
All someone needs at times is just for someone to say, okay, this is me. I went through. I have pictures to show. Yeah. And that's just it. And the person is like, okay, once Fafa has been able to go through, I can go through too. Some people need financial support. Some people need love.
Yeah.
People call me from time to time and they ask, how did you do it? There's no formula to it. It's just God. There's no formula to it. But I realized out of pain, purpose is born. And that is how come came by the Jidula Pink Foundation. Oh. We fight and we win. Yeah. Fight and win. So, God willing, on the 5th December, we'll be launching the foundation at the Grand Men's Vic Hotel, East Legon. That's the Farmers' Day at 3 p.m. You're all invited.
We will be
Please come and support everybody.
We are definitely going to be there. I'm so proud of you.
Thank you.
So do you have any activities scheduled for the month of October as well?
Actually, I've been, even before October, from September, I've been doing a lot of productions, podcasts, interviews here and there. Immediately I leave here, I have another interview.
Oh, wow.
Yes, so I'll be posting them on my foundation platform.
Okay.
I have a website. We're still building the website, too, but I have a page on Facebook and Instagram. It is the same name, the Jidula Pink Foundation.
Okay.
So follow us, like us, and then let's keep rolling. It's a movement.
Yeah, it is a movement.
It's a movement.
Yes.
We should all get involved. It could be your sister, your wife, your mother, your friend. It could be anyone. So please, it's a movement. Let's all get involved. And for those who want to sponsor, who wants to partner with us, please get in touch with us. The Jidula Pink Foundation.
Oh,
Thank you.
So proud of you, Papa. So proud of you. You know, when you came last year, your song, Asida by Nasi. We have to play that song when we
know, right?
Show, though. But Bisayen, awareness is what? Awareness first, the first step of prevention. So a group of doctors and nurses, right?
doctors and other health workers.
Other health workers have come together to do this.
Yes.
Tell us what you have planned for this month. And this month, we are going to be spending with you changes, right? So we're going to have more doctors from Bisayen coming in.
Okay, so the Bisayen Foundation is from the Global Outreach Consortium, and it's all about breast cancer awareness. So this month, we are actually collaborating with SOFPOG. SOFPOG is the Society of Family Physicians of Ghana. And we will be doing outreaches, we'll be doing free screening, we'll be doing daily education. We'll also be featuring massively on social media. So you can follow Bisayen on social media. You can follow the SOFPOG pages on social media so that you get the information and you can also disseminate it. But our education and screening will be at the Kolebu Polyclinic.
Okay.
Yes, so every day from 8 to 2, starting from next week.
Okay.
We'll be doing free screening for women who walk in. And for men, please, men also get breast cancer. So
and it's free for men as well?
It's free, yes. It's free for all. So walk in, get your breast examined, and then get some education on breast cancer as well. So that is what we'll be doing for the month of October.
Okay, that's great. Is there a number people can call just in case they want to make inquiries?
So we had a toll-free number. Unfortunately, it is not active now.
Okay.
So if you check us on social media, you can send a DM on social media.
And this is free?
Yes.
Wow. Yes. Congratulations and thank you for that. We Ghanaians love free things, don't we?
Who doesn't?
Yes. But I encourage a lot of people to be a part of it because most people are scared to check, you know. Most people are so scared. Yeah, it's just the fact that I go checking and I'm told, hey, so it's like when you're going to check, your heart is beating so fast. I mean, but thank you for doing this.
It's important to check.
It's important
to know.
It's better to know, yeah.
All right, so thank you so much for being here. We are so grateful. And want to also tell everybody out there that it's Pink October, is Breast Cancer Awareness Month. And so what we'll be doing here on Changes is that we'll be talking more about breast cancer and raising the awareness. We are partnering with Bisayen. And if you have any foundation out there as well and you want us to support because of the Breast Cancer Awareness Month, let us know and we will talk about what you want to do right here on Changes because we wish to raise the awareness. Thank you all so much for being here. You are amazing. A big thank you to you, Papa Gogo, and congratulations once again. Girl, 5th of December, God will give us life and we'll be there to support you. Right. And Dr. Anita, thank you so much for being here as well.